So my name is Emily Lemiska, and I am Director of Communications and Educational Programming at US Pain Foundation. Hopefully you've joined our webinars in the past and have seen me before. If not, welcome. We're so glad to have you here with us. Whether you're joining on Zoom or on Facebook, we're delighted to have you with us tonight. So we are very excited because this event is kicking off our Pain Awareness Month series of events. And there's no one better to do that with than Peter Abaci. So before he starts, I'm just going to go through some housekeeping items and some introductions. And then I will turn it over to Dr. Abaci for his presentation, which we're super excited about. And then we will open it up to a Q&A. So you can type your questions into Zoom by hitting the Q&A button at the bottom of your screen. If you're on Facebook, you can just comment your question and we will get to those as well. You probably noticed that you are on mute and your cameras are off. So hopefully you're used to Zoom. We've all been Zooming a lot lately. And also, if you have to jump off for any reason, we do record all of our webinars. So this webinar will be available as a recording on our website within the next 24 to 48 hours. So we welcome you to, if something comes up, we know school just started and things are really busy. If you need to jump off, feel free to check it back out later on. And you can also check out recordings of all of our webinars. So like I said, this is the first event in our Pain Awareness Month series. Our theme this year is My Pain Plan. And the idea behind that theme is that everyone deserves an individualized, multidisciplinary plan for their pain. We're all unique and our plans for our pain should be too. So our big initiative this year is that we launched mypainplan.org. It's a site where you can visit and you can create your own pain plan and explore a bunch of different options for treatment. And you can choose whether or not to add those treatments to your plan, and then you can print it and share it, whether you just want it for yourself or if you want to share it with a provider. But the really fun thing is that while supplies last, just for completing your plan, you can get a free heating pad from our sponsor. So an added little incentive to take an active role in your pain management. We also just released a survey this week, a survey that a lot of you participated in. I think it was roughly almost 1,600 pain warriors responded to that. So you can learn all about that and help us spread the word about barriers to individualized and multidisciplinary care. Because we know that is best practice in pain management, but too often things like cost and not being able to drive and all kinds of things get in the way. So that survey takes a look at all those different obstacles. Then of course we have events like tonight, and also we have a whole bunch of fun things happening on social media. And if you're posting about Pain Awareness Month, we encourage you to use the hashtag #MyPainPlan to help us spread the word about our theme. And all of that stuff, you can learn all about it on our website, uspainawarenessmonth.com. So go check that out when you have a chance and get involved. And all of this would not be possible without our 2020 Pain Awareness Month presenting sponsor, Sunbeam, a company that makes heating pads. So thank you to Sunbeam. So with that, I'm going to introduce Dr. Abaci. He is a expert in multidisciplinary integrated care. He's also just a wonderful guy and he's really passionate about helping patients. So we're very lucky to have him with us. He is the medical director and co-founder of the Bay Area Pain and Wellness Center, which is located in the San Francisco Bay Area. There, his innovative strategies for integrative pain treatment have helped restore the lives of thousands struggling with pain. The Bay Area Pain and Wellness Center, now a part of the IPM Medical Group, is one of the few freestanding outpatient interdisciplinary pain centers in the Western United States that is also CARF accredited. And I believe that has something to do with rehabilitation. So Dr. Abaci, maybe you can let us know what that stands for later. He is also the author of 2 books, Conquer Your Chronic Pain, a life-changing drug-free approach for relief, recovery, and restoration, and Take Charge of Your Chronic Pain, the latest research, cutting-edge tools, and alternative treatments for feeling better. He is a regular contributor to WebMD and Pain Relief Revolution, of which he is the creator and editor. And from 2013 to 2016, he also hosted and produced the acclaimed radio show, Health Revolution Radio for iHeartMedia. So, as you can see, Dr. Abaci is really an expert in pain, and we are very lucky to have him. So with that, I'm going to turn it over to him. And remember, throughout his presentation, if you think of a question, something pops into your head, just type it into that Q&A panel if you're on Zoom. If you're on Facebook, just put it into the comments and we will take those questions at the end. So, Dr. Abaci, I'm going to have you turn on your camera and make sure you're unmuted. There you are. Okay, and let's see if you can get your screen share working.
Yeah, I'll be good to start that in just a sec.
Okay, awesome. All right,
Yeah.
thank you so much and welcome.
Thank you. Thanks for having me, guys. Emily, thanks for the very nice introduction.
No problem.
And Pain Warriors, thanks for having me share Pain Awareness Month with you guys. It's an honor to speak with you this evening. And, you know, it's interesting, you know, the subject we're talking about today is managing pain at home. And why is that such a hot topic? Because we're in the middle of this just intense pandemic, right? The COVID-19 coronavirus situation has really kind of taken over our country in a lot of ways. And when you think about what's going on, we've got this health problem that has turned upside down the lives of so many people, their jobs, their school, their friends and family can't interact with each other. Lives are so much upended now because of what's going on. And yet, it's this sort of unknown virus, that we're just learning about. And there's all this anxiety and stress about, what is it all about? What do we do? How do we tackle this? And so there's all this, high level of angst and anxiety about this health crisis that we're in. And, it's interesting, when I think about that, and I think about, all of us who have, been dealing with chronic pain, maybe in some cases for years, this is kind of what you guys know, what you guys are experts about. You know what it's like to have your life in some ways maybe upended by a medical problem that maybe other people don't understand well or seems invisible. And in a lot of ways, you might be in a position to mentor, inspire, help our country through what's going on, because you guys have been fighting these kind of battles, probably many of you for a long, long time. And so now the rest of the country is kind of dealing with the sort of angst of dealing with an overwhelming healthcare problem, at least in some communities and in a lot of communities. So I'm going to screen share now, and that's going to kind of segue a little bit into what's going on with this pandemic. And excuse me a sec here while I get this all shared. And there we go. So my slides not advancing. Try. Huh. I'm sorry. Give me a sec to figure out why.
No worries.
While I'm doing that, what I wanted to talk about is starting from a behavioral health standpoint and looking at what's going on in our country, and looking at some of the research and data going on with that. There we go. Sorry about that. So they've been looking at how's this affecting the country from a psychological standpoint. And what we're seeing is research is showing that about 40% of the people in this country are reporting mental health problems directly as a result of dealing with COVID-19. And what we're seeing is huge increases in depression, in anxiety, trauma symptoms, spikes in substance abuse problems, suicidal ideation seems to be significantly increased. So there is high levels of psychological distress in many different forms. That's way up. Anxiety is about 3 times higher than it was last year. Depression's about 4 times higher. than it was last year. So we see that our country is really dealing with a huge amount of stress. And when we look at who's having the hardest time with that, we're seeing that young people, young adults in particular, are feeling the most stressed. People of color are particularly stressed out about what's going on. Caregivers, highly stressful situation for caregivers, as you can imagine. Essential workers, of course, this is a very challenging, difficult time to be an essential worker or a frontline healthcare worker for sure. And anybody who has some pre-existing mental health history, these are the people who are the most affected. But I think the research shows that the country as a whole is dramatically affected by what's going on. And, it's interesting when this all started, and we started locking down in my community, things started in March, and initially we had to close our clinic and just do telehealth, telemedicine, communication with our patients, and we continued to do that. So I continued to speak with my patients, from the very beginning of this, all through the whole process until we started to slowly open again. But what I saw was in the beginning, I think everybody was stressed because there was all this anxiety of the unknown. We didn't know what's going on. And so there was a high level of stress that I think everybody could feel, it was very palpable. And then as the weeks went on and this started to become longer and longer and this dragged on, what I started to see with a lot of my patients that I work with is some people emotionally start to go one way and some people emotionally start to go a different way. And the, one direction that I think I've seen happen for a lot of people as this situation has continued, is we start to get angry, and we start to see high levels of anger, and how we get more snappy, more edgy, and we have a harder time with that side of our emotion, and so I see that happen for a lot of people, and I think when that happens, it makes the situation, including managing the pain, all that more challenging. The other direction that I see some people go is more towards one of gratitude and just feeling grateful, that, there's, communication going on, or there's, people trying to help and, do things for them, and, or just, feeling gratitude towards still being, well in some respects. So I see some people going down that direction, and I see some people going the other way. And it speaks to, I think, gratitude is an important place to be. When we experience gratitude, our stress levels go down, our mental health gets better, just how we feel inside gets a lot better. And so just think about that. If that seems to be slipping away, that we want to sort of cast our anchor away from the place of anger and more towards the place of gratitude. And it's, of course, I see this happening not just with people in pain, but with everybody in this country. I think that's part of what we're grappling with. Taking that as it is, then you on top of that, you layer all this challenging emotional stuff going on. And here you are with a pain problem. Here you are trying to better manage your pain. Here you are trying to deal with maybe complicated health problems. And you start to get more stressed about how do I connect with healthcare people that I need? How do I, am I going to, is this pandemic going to interfere with my ability to, get my medications in the mail or talk to the right doctors or have access to other supportive people that help take care of me? Is the person who maybe helps me out, my neighbor, can they still interact with me? Is it safe to do that? There's so many questions in the back of our minds going on all the time, and it just raises our stress levels higher and higher from maybe already, before the pandemic, already having maybe stressful situations that we're dealing with. So that's kind of the backdrop of where we are today, and why it speaks to how important it is that we have a good plan for ourselves, and that we're a little bit planful, and that we get on top of this situation, because it's going to make us healthier and help us manage our pain better. And the better we can take care of ourselves, the better we can help our family and friends and other people who maybe are also depending on us. And, you know, everything's changed, right? The way that, I know for me, where I eat, how I eat, where I go grocery shopping, how I get my groceries, how I interact with my doctor, where I go, where I go for, I don't go to gym anymore, so many things in my life, the way I normally carried myself on a day-to-day basis has completely changed. And my guess is a lot of you can relate to that and say, yes, so many things, has changed. And change is so hard, it's so hard to deal with, but it's really important that we figure out how to best adapt to these changes that are taking place so that we win and we succeed and, we get the pain, back in a box again. And so that we get back to living again. I think it's important to identify, this is a crazy time. There's things we can control about what's going on, and we want to take charge of those things. And then there's things that, going on that we don't have control over. And we don't want to get too wrapped up or too stressed out over what we can change, but really focus on the things that we have some control over and then be proactive and in a healthy way with what we can. And I think that as you try to figure out how to adapt to changing to what's going on and what you need to do, it's important to kind of reconnect with what your core values are, because what you want to accomplish, what your core values are, that's not changing. Who you are, what you're about, how you want to impact the world, what you want, how you want to overcome, your healthcare challenges and be the person that, you want to be and live the life you want to live. That shouldn't change. And so what has to change is how you get there and how do you have to evolve or revolve around what's going on so that all happens. And so now, I don't know about you guys, but up until 6 or 7 months ago, I had no time for telehealth. We didn't do telemedicine visits. I wasn't really that interested on, doing things on Zoom or Facebook Live or, interacting with my patients outside of being face-to-face in the exam room. But that's not how things are anymore. And the new normal is telehealth has become a really big deal, and when we say telehealth, we're talking about certainly telemedicine where we're interacting with medical providers like doctors, nurse practitioners, but we're also talking about accessing, things like physical therapy or a pain psychologist or, doing yoga or all these other ways of interacting with how we can manage our health. And so this becomes this is like a thing now, right? And it's certainly become a part of my professional life that I'm trying to get my arms around and do a better job on behalf of my patients for. And when I talk to other doctors in other specialties, even in other parts of the country, they all seem to feel like this is going to be something that's going to be here to stay. So having said that, and recognizing that at least for a while longer, we don't know how long, but it seems like we're going to have to be more homebound than we ever were before for, probably at least for months to come. And we really don't know how much longer, but it seems to be going to be part of our future, at least for what, the here and now. And as we think about that, we want to say, okay, how do I set myself up in a position to win where I know I have to spend more of my time managing my health from home? And I have just a couple of, tips or suggestions based on how we can do that. And, I've had an opportunity now to do a lot of telehealth things with our patients because we're in a more interdisciplinary center where I work. I know what it's like for people to do physical therapy, through Zoom or to talk to a psychologist that way, or to do a comprehensive program or, to hear lectures and talks, as well as do individual face-to-face interactions. And so, there's some things that I think we've learned very quickly that help empower you guys for success. So one is to create a healing space for yourself, so you're at home and there might be maybe a few other people that you're cohabitating with, or maybe a lot of people, or maybe not. But however it is, I think you want to find a space that can be utilized by yourself. And believe me, it does not have to be a big space. It does not have to be, Gold's Gym. It just, a very small area, but an area that you feel safe in, that you feel comfortable in, that you feel like you can focus on, your health, your well-being for whatever times of the day that are set aside for that, where you can focus on managing your health and your pain. So finding that space and making it look and feel, maybe smell, with aromas, however that works best for you, spend a little time on that, create your special space. Second tip is to kind of set up a pain relief calendar, for yourself. And so when you think about it, and let me just give you this example that I talk about when I do some of my lectures with our own patients, and I talk about it a little bit in my second book. Think about the world we live in. It's like a casino. When you walk into a casino, what is it like? You're bombarded, right, with sensory overload, with lights blinking, noise, it's loud, there's a lot of ding 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 and bling bling bling, and there's no windows and there's no clocks, and it's like that to overwhelm you. And the goal of every casino is to get your money, right? They want you to spend more time there. They don't want you to leave. They don't want you to go from point A to point Z. And so they overload you so that you lose focus on the rest of your day and how you're going to spend your time, and that's how they make more money. And the world we live in can easily feel or behave like a casino, where there's sensory overload all the time. And, the more technologically advanced we get, with our cell phones and our messages and social media and things like that, the more these things we get, the more distracted we can get, and the harder it is to really focus. So we have to become disciplined, and we have to set up structure and a schedule for ourselves and a calendar for when are we going to do things that are good for our health, like maybe stretching exercises or other exercises, or get some time for some fresh air, or walk outside, or to prepare, a healthy meal, or, whatever the things are that you think can be a valuable part of your plan. Start to, get the calendar on your, on your phone, or if you have a written one, however you like to do it, and fill it up, and make sure you stay disciplined and try to stay with that. So think about that. Next tip is we can use telehealth to increase access. So, in the traditional way, where you'd only talk to your doctor when you go see your doctor, maybe your visit would be, maybe once a month or every couple months. And now there might be, in some situations, the opportunity to interact and communicate with your own doctors more frequently, and maybe get more education and feedback that way. Or you might have access to other specialists, or whether pain specialists or other kind of gurus out there that maybe were outside of your geography, that maybe you couldn't see before, and maybe now, or maybe you live in a remote area, and you can go visit somebody, and or connect with somebody virtually that you couldn't maybe see otherwise. And so this gives you the opportunity to start to expand your horizons a little bit, and maybe maybe you always wanted to talk to a nutritionist, and maybe now's a chance that you can connect with somebody virtually to get some tips on better, healthier eating for better pain management. So we have those opportunities. Before I go on to my last one, also we're doing some poll questions with you guys today, and I'm going to stop here just for a sec. Emily's going to give you a poll question, and then we're going to have a couple more as we go. So Emily, lay the first one on us, please.
Yeah, okay. So I'm going to launch this first poll. So the poll is, you should see it pop up on your screen. Since the pandemic started, have you found it more difficult to access medical care? So, whether that's your doctor's office is closed, or you can't quite figure out telehealth. Maybe you're afraid to go into the office because of COVID. So I'll leave this open for maybe 10 more seconds, because I see most people have submitted a vote. Just a few more seconds. Okay, some stragglers. Okay, going to end the poll here. So our results was that 55% said yes and 45% said no. So that's pretty evenly split, which is interesting.
Oh, interesting little split there, Emily. Okay, um, that's good. All right, shall we shall we keep rolling?
Yeah.
So my last sort of telehealth tip is try not to get too bogged down with all of this because this can be overwhelming, and try not to get bogged down in a couple of ways. One is, for some people, the challenge is just the technology. Setting up things like the Zoom or the apps, or figuring out how to make the technology work. And I think some people that I work with, I know that's an area of stress. And if that seems to be a problem, or if you know other people who are having that problem, I think helping somebody, or if you need help, getting a little help, I always say, get the young person to help you. A younger person many times is going to be pretty smooth and swift with managing some of this technology. And so if you find that to be a barrier, if you have like a young, child, daughter, grandson, granddaughter, or neighbor, or whatever, let them help you get kick-started with that. Don't be embarrassed to ask for help. Second thing is, in avoiding getting too bogged down, is there's a lot of stuff out there, right? It's daunting. There's so many different apps and YouTube videos on exercising and doing this and doing that. And, you can get lost in a haystack, of all this content of things that you could be doing out there, and you don't know what to do. You don't know where to start. I know if I go shopping and there's too many things to choose from in the store, I just sort of get frozen and I don't get very far. I need a limited amount of choices. And I think a good way to approach that is start from a place of trust, and pick somebody or something that you feel like you trust and you can get behind, and maybe just start with a few things, keep it simple, and then you can slowly branch out or build off of that later. So and maybe you rely on a good tip from a friend or a colleague, or somebody maybe has a similar pain problem that you do, and don't have to worry about trying every app known to mankind. Just keep it really simple and something that you really think you can trust. And this picture is courtesy of the Wall Street Journal. So how do you do all this at home? Get the safe space, get the nice calendar, find some good YouTubes or apps or things, and then everybody else's life is going on around you, right? It's there's all maybe there might be a lot of moving parts, and how do you best navigate all that? And so that can sometimes be an area of stress. And of course, it starts with communication, but also constructive communication, and talking about, well, how can we make this work for everybody who has things that they need to do while they're at home. And going back to structure again, I think that the calendar and the structure of, let's say, for example, this space is my healing space, and I'll use it from 10 to 12 in the morning, say, and then from 1 to 3, it's your time. It's your turn to use that space. And so you start to come up with structure that is not just your own schedule for yourself, but also starts to interact with and take into consideration the needs of other people in the home. So you start to collaborate on setting up a good plan on how to best use your time and energy at home. It's also good to have a plan around the chores and how the chores get done. There are some situations where you might feel like it's all on you to get everything done around the house, and now everybody's spending more time at home, and so maybe there's more mess being made and a need to clean up things more, and that all can happen, and that's not good. You can't take too much on your shoulders at home because of how the situation has changed. There needs to be the right balance with that, and maybe some sharing of roles and responsibilities and chores. So it might be good to have a conversation with those that you're living with about how can we divvy this up so that nobody's getting overtaxed in this situation. And And then I think it's good to, recognize that there are times, where everybody's going to be together or maybe interact, where maybe we're going to play a game together, or we're going to share watching a TV show together, or, we do something together. But then, maybe we all need some time to ourselves, where we can, have our own alone time, to do what we want to do with that time, whether it's, read something or listen to some music, or do whatever it takes that, is good for your health. So finding the balance between what we're doing and spending time together versus having the right amount of time, to be just some special alone time. So doing all that, I think starts to build boundaries around a good collaborative home situation that, you may have to adjust and revise frequently, but it's worth doing. And so, we're talking about the added levels of stress that we're all dealing with, and how much harder it might be as pain patients to navigate what's going on. So kind of looking at some tools or tips to reconnect with our resilience is what I want to talk a little bit about next. Before I do that, I want to get to our next poll question. Emily, what do you got for us next?
Okay, let me pull up our next question here. So I'm going to launch this poll. Just tying back to Dr. Abaci's last slide, did being in quarantine stress relationships at home? And we know that chronic pain can put a lot of stress on relationships to begin with. So, quarantine and COVID-19 certainly could add an extra level of challenge there. So we'll leave this open for another maybe 5 seconds. See lots of answers coming through. So thank you guys. All right, I'm going to end the poll. And this is really interesting. So again, about evenly split. So some people saying yes, and some people saying no, maybe because people with pain are sometimes used to being home and can't go out much to begin with, but that's interesting.
Wow. Well, hopefully some of the things that we're talking about can hopefully help with some of the people who are having a harder time with some of these things. Because, I think it's something a lot of homes and families are having a hard time with is just how do we all work together at home. So going back to resilience then, and how do we build more resilience to win, to overcome the challenges that we're dealing with. I like to talk about, before we dive into some of the specifics, just the whole idea of the 4 seasons, that Mother Nature is all about the 4 seasons. We have winter, and then spring, and then summer, and then fall. And that happens every year like clockwork. That's the way the world is meant to be. And I think the ups and downs of life, the times for growth and to sprout flowers and fruit and things like that, it does require the winter time and the fall before that, where things go dormant. And we go through these cycles. It's natural. And I think that we're in a challenging time, and for a lot of people, this is winter. And I think that's as part of life cycle. But it's not natural to stay stuck in winter forever. And at some point, we have to move forward. We have to move on. It's not healthy, and it's very stressful if we just stay stuck in a bad place too long, or in that sort of place of winter. So finding the tips and strategies and the mindset to help us work into a place of growth and start to grow and develop and evolve, what's going on is really important. And that's part of how, building resilience and tapping into that, I think is important. My first tip with resilience is to find meaning in adversity. And I think this is really important. We many of us maybe has developed our pain problems by maybe we got something we inherited, maybe we were injured, maybe things happened, maybe we were somebody ran into us, or we got rear-ended, or so many different things can happen that are unfortunate not our fault, but unfortunately happen. And we need to see where is the positive in that. Where do we find something valuable that we can take out of a situation that we don't want to be in, that we don't like. And we certainly don't like experiencing a lot of pain all the time. But how can we grow from that? And how can we find something positive in that that will help us move forward in a good direction? So that's one part of resilience. My second tip is what I called building optimism. And a lot of interesting research on optimism, and we see that basically being optimistic is being able to see some positive or some good in a situation that maybe is balanced, and there's some good and bad in any given situation most of the time. And if we just focus on the real negative downside of it all the time, that drags us down. But when we start to see, some of the good, at times, as we become more and more optimistic about that, or see more of the good in a situation, the more it boosts us up. And research shows that when people are more optimistic, in their thinking patterns, their pain gets better managed, and other aspects of their health seem to improve. So optimism is good for our health. And then a third, important part of building, better resilience is, we talked about change earlier, accepting change and saying, okay, reality is the world is changing every day, all the time. And we can fight it or we can, accept that that's the way things are. And we need to evolve and grow and adapt with that. And being adaptable around change makes us stronger, makes us more resilient. I think, as I said earlier, change is really hard. I hate it when I have to get a new iPhone, or when they do upgrades to my software, things like that. I go bonkers, and it's especially the technology stuff. Is hard for me. But we all have things that change is hard. In our lives. In specific ways, and so we just have to kind of get our arms around that and say, okay, we got to move forward. Next one is, I think that having goals and moving towards those goals is something really important to keep in the back of our minds. What are we trying to do? What are we trying to accomplish? Where do we want to be? Where do we see ourselves, working towards as we develop our pain management plan, our pain management strategies for ourselves? As we do that, what's the path look like, and where is it taking us? So keep that in the back of your mind and refer back to that frequently. So it's really important so that you know what you're about and where you're going. The last sort of tip for building resilience is to connect with positive people. And research shows that happy people often will gravitate towards other happy people. And if there are ways, you don't have to, none of us have total control over our how that runs, but seek out somebody that you can connect with in some way that's motivational, inspiring, or you just like to be around, puts you in a good mood, has a good sense of humor, or has, maybe they have a similar problem, health problem that you have, and they're working through it, and maybe just having that person to collaborate with, pumps you up and lifts you up. So finding just, someone out there that you can connect with in some way. And, of course, it's really hard it's harder to connect with people during this, pandemic situation that we're in. But why it's important to see what resources are out there by, virtual settings and telehealth. And I, that's, certainly one of the huge advantages of being, in the U.S. Pain Foundation, being a part of this, community and pain warriors working together, I think can be very powerful. And so as we all come together and try to help each other, it makes us stronger, and it makes us more resilient. And then what I wanted to talk a little bit about kind of towards the end is what I consider my kind of 5 keys to success in developing a pain management plan for yourselves that will help you knock it out of the park, I hope. Before I do that, I think it's time for another poll question, though. Emily, can you give us a third poll question?
So I'm actually, I'm going to surprise you. I'm not going to launch a poll, but I did want to read just a couple of things that people have been saying in the chat. And
Okay.
a couple people brought up that they actually live alone, which is why, quarantining hasn't increased their stress. But then we started sort of talking in the chat a little bit about things that help, even if you live alone or are feeling isolated. Someone said they try to focus on dynamic goals because their body's always changing, which I thought was really a great kind of attitude about, some days it might be walking around the block, some days it might be walking 2 miles. We also had Charity saying she tries to find the silver lining in at least one thing each day. That's how she approaches each day and has raised her kids to live. And then people talking a lot about how online activities have been really helpful, support groups and, finding online exercise programs have really, really helped folks, especially right now. So I just wanted to mention some of those things.
Thank you for doing that. I think those are great points. And interesting thing that I think we've started to learn in the last several months is with the online stuff and some of the chat rooms and virtual treatment therapeutic settings is people can really connect in this way, in a deeper emotional way, even though we're not sitting in the same room face to face. And I've seen patients really be able to process a lot of deep things sometimes. It may be a little bit harder to do because we're a little bit more distant and separated by being virtual. But if we're open to it and we seek it out, we might find places that we can go in a virtual setting where we can feel comfortable, where we can share, where we can open up, and we can use it as a safe place to heal and process. I see it happening. And as I said earlier, I never thought it would work so well that way or could work so well that way, at least for some people. But I'm seeing it happen. And it's great to see when it works out. So thank you for bringing that up. And then I just wanted to end with, because I always like to bring these up as a little reminder in most of my presentations and talks. So if this might be review for a few people, but I think look at the keys to success. Mobility is really important, because when you think about how much our quality of life revolves around our ability to just get around, and any things that we can do to help us be a little bit more mobile, expands our world sometimes exponentially. It might be the difference between being able to cross the street or not crossing the street as far as where we go, during the day, or being able to do, interactive things that maybe are fun, or go places we like to go, or see things we like to see. Any little things that we can do with our treatment plans that lead to increased levels of mobility is going to improve quality of life. It doesn't just have to be walking either. It can be driving or using public transportation, or just sort of problem solving for ways of getting around a little bit better can make big changes to quality of life. Second one is interaction. And, I think it's not about having a lot of Facebook friends, right? It's about having some quality social bonds, quality social connections. When we have that, we see, research seems to show that we're healthier and happier, and and there's just a lot of good health benefit. And we want to get that out of whatever we're doing with our treatment plans. But when we think about, when you have pain, that may interrupt a lot of social bonds, right? Maybe, for example, maybe you're not going to work anymore because of bad pain or bad injury. Think about all the people you were maybe friends with at work that you don't get to see anymore, or maybe you're just not in the mood all the time to talk to people, and you want to hold back, or So what kind of things could be done to make you feel more comfortable, talking to people, opening up, or connecting with other people? Those are powerful, impactful treatments. Look for things like that help improve the quality of your social bonds. Third one is independence. Look for things that make you feel like you're a little bit more independent in how you manage things. I mean, I think, nobody likes being totally dependent on other people for everything. But, it's okay, to appreciate and value help, when we get it. But as we start to develop the ability to become a little bit more independent with different things, during our day, it starts to make us feel better. It starts to make us feel more confident. And then we can start to build on that. And I think it's a little bit empowering to have a little bit more control over what's going on in our day. And I think it's a little bit more stressful to have less control. So I think this helps the situation. So, when you're thinking about what kind of strategies can you add to your treatment plan that will lead to you feeling like you're in a place of being a little bit more independent, will make you feel better. My fourth one is something called validation. And I think it's really important because, when I often meet with a person for the first time, I almost always hear about how they don't feel like, they don't feel very well understood, by family members, coworkers, doctors many times. And, many times, or even, understand what they're going through, or maybe even believe that they're suffering as much as they are, because it's maybe hard to see. For many people, chronic pain is a silent disease, and others don't understand it well. And so that's a thing. And we don't have good tests or things that can explain to other people what you might be going through. But that's not a good reason to let that, screw things up for you. And you can't get too hung up on what other people are thinking or how other people are judging you, in how you see yourself. And at some point you have to, let some of that go, maybe be good in your own skin, and be in a place where you can move forward with whatever health problems you have, and start to feel like, hey, there's 50 million Americans with chronic pain out there, right? You're not the only one. And that means it's a problem that affects probably one person every family, right? So it's every family at some point in America is probably going to have to deal with a pain problem. So, people need to start to understand that. And we also know that 11 million people in America have what we call high impact chronic pain, where the pain is so significant that it interferes with people doing basic daily activities. So that's a lot of people. And then my fifth one, my last one, my most important one to me is love. And I think the most important thing, the biggest core value in life to a happy, quality, good life is the love that we experience in our life. And I think love is a two-way thing. We all need to be loved. We need to experience that. That's part of of every human need. But also, I think to be truly fulfilled in our lives, we need to be able to express love towards other people. So I think it needs to become a two-way thing. And of course, there's many faces to that. There's romantic love, there's intimacy, but there's also friendship, brother, sister, family. There's many sides to what love is all about. But man, nothing can screw up love in our lives more than having a pain problem. It can strip love away in so many different ways, from, just how it affects our ability to visit friends, to our ability to be able to be intimate with someone else, to, being able to feel up to, sharing love for somebody else. So, any treatments that we can do that can bring love into our lives and help us not push love away from our lives is going to be so impactful. So take a step back, ask yourself, is the medications I'm taking, is the surgeries I have, or the procedures I do, or the doctors I see, or whatever it is it bringing more love in my life? And if you feel like it's not, if we're not getting there, then we need to take a step back and say, well, how can I tweak this? How can I change this? So that I feel like I'm connecting with the world around me in a way that ups the love that I'm experiencing. At the end of the day, I do think it's the most important thing. And it's reasonable to expect to get that out of your healthcare. Why not? So I'm going to stop there for a sec. I think we're going to do we want to do another poll question, Emily?
Yes, we could do. We have one other poll.
All right, let's fire away at that.
Might be interesting here. So sort of along the lines of all that we're talking about, are you worried that having chronic pain puts you at greater risk if you contract COVID-19? So let us know yes or no, and we'll close it in just 5 seconds here. So, and thanks to all of you who are talking in the chat. I'll share some of your comments with Dr. Abaci during our Q&A in just a few minutes. Okay, I'm going to end the poll now. Share the results. So it looks like most people, definitely the majority, are, have this added layer of stress, worrying that chronic pain puts them at higher risk for COVID-19, and rightfully so.
Yeah. And and that's a lot of, there's so much we don't know about the disease yet, and how it, what risk we are if we have, rheumatoid arthritis and we need to be on immunosuppressive medications, or if we're on other types of pain medications, or, if we're under a lot of stress, and how does that affect our ability to fight infections. So many different things that, we don't really know the answers yet. And, but, hopefully we can all, work together, support each other, help each other better manage our stress, do the little things that we can to boost our immune function. So Emily, do we have some questions or comments that we want to talk about next?
Yes, for sure. We've had a lot of questions coming.
Uh-oh, that's either good or bad.
No, it's good here. So let me see. I'm going to pull some of these up. I don't know if you want to close your, well, so here's where you can find, some of you were asking where to find Dr. Abaci. So here's all these links to where you can locate him. So peterabaci.com is certainly easy to remember. So the first thing I actually wanted to do was, I know I shared a couple of the tips that people said were, helping them personally. So like the dynamic goals, which I think is really important when you have pain, kind of being flexible with yourself about what you can accomplish and not being hung up on a huge goal, being grateful like you talked about. But also someone mentioned using a meditation app. Someone talked about how their pet has really been helpful because they live alone, and really, just a source of joy every day. Someone talked about listening to relaxing music. Someone else talked about nature videos, which I'm a huge fan of myself.
And I didn't mention virtual reality either.
Yeah.
That's a great thing we can do at home. Yeah, those are great. That's great feedback.
Yeah, no, I thought there were some good tips. So I just wanted to share those. And then, before I get into some of our more specific questions, and just a reminder, if you're tuning in on Facebook, please type your questions into the comment section and we will get to those as well. But one question that we had right off the bat was someone who was asking about, how do you find a doctor who you feel like really cares about you and really validates you, like you were talking about? Do you have any sort of tips and what to look for? And I think that's especially hard now. Sometimes in person you can kind of get a good feel for whether the doctor is a good fit, but maybe over telehealth it's a little harder. So I was wondering if you could kind of speak to maybe some tips on how to try to find the right provider.
Yes, that's a great question. I've tried to write a little bit about that in my second book too, how to work with your doctor. But I think the most important thing to me is to ask the magic question. And the magic question is, when you're talking to your doctor or your provider, and they're telling you something or recommending something, or they want to prescribe something, or do a treatment. The magic question is, hey, is that what you would do if you were me? Or is that what you would do if I was your spouse or your mother, or your daughter, whatever it is?
Mm-hmm.
If I was part of your family, your nucleus, is that what you would want for me? Would you want your spouse to be taking those medicines, or to have that procedure done, or whatever it is? I think that's the most important fundamental question. And if the answer that the doctor or the provider said is not an emphatic yes, then we got a problem. You want to see the person who walks the walk, and talks the talk, and says, if they think this is the way to go with your pain management or your healthcare, then that's got to be something they would embrace for themselves too, I think. And so that's really important. I also think it's important when you're interacting, with your healthcare provider. And I think about things where it makes it difficult in the relationship. One is if you have in your mind a set agenda before you go in the room or before you have the interaction on telehealth, sometimes you become closed-minded to what maybe that person is trying to say or can offer you. And so it's good to not have too much of a hard agenda of I'm going in there and I'm getting this and I'm not leaving without whatever that is. So to try to be a little bit more collaborative, with the doctor, I think builds a better working relationship, and there's more, back and forth and working together, a more collaborative feeling.
That is great advice. I really like that. And I should have mentioned before at the very beginning, so I just wanted to say I've been sort of typing with a couple of you, but Dr. Abaci can't answer really specific medical questions, so he can't answer like how to treat X disease. So he can definitely do more general questions, like the one that we just gave as an example. So just something to keep in mind. Sorry, I didn't mention that earlier. We do have another kind of follow-up question on what we just talked about. And I think this is a good one and sort of a tough one too. Do you have any advice for someone who's trying to find a new doctor, but doesn't want to like jump ship from their current doctor until they're sure they found a good fit? And I know it's especially hard when you have pain because, with the opioid crisis, doctors are very, they want to be seeing one patient at a time and they don't want to think that you're doctor shopping per se. So it's definitely a fine line to walk. So I
Yeah,
don't know if you had any suggestions about that.
I do. So one is most states, if not all states, have some sort of drug monitoring system in place. So
Mm-hmm.
if you're going to a doctor who's prescribing you, controlled substance type medications, and you go see another doctor, and if that doctor also prescribes something that's going to show up on the monitoring, the doctors are going to see that it's going to show up, and they're going to think there's a problem, that maybe your doctor shopping or trying to, do something like that. So but at the same time, I think there's nothing wrong with getting other opinions or seeing what else is out there. And so when you do that, I think it's important that while you're in the sort of discovery phase or feeling out phase, don't let them prescribe anything. Don't even really start any treatment. Don't go to one doctor for an epidural and then go see the other doctor for an epidural injection, or anything like that. I
Mm-hmm.
think, just spend time with the doctor, get to know them a little bit, and just tell them, hey, I'm just here to see what what you think or what you may have to offer. Don't
Right.
get involved in the treatment yet until you decide, I really want to work with that person now. I'm all in. I'm all in with this doctor. And then you stop getting prescriptions or treatments from the other doctor and you switch it over.
That is some good advice. And then something that's in the same vein in some ways, um, but they're talking about how their pain doctor is not interested in providing any telehealth options, unfortunately.
Mm.
So I don't know. In my mind, I'm like, okay, well, maybe you should find a different doctor because that's really, can be difficult for someone. But I don't know if you had any specific advice for someone whose doctor is not open to telehealth. Um,
It's the first I've heard of that. It seems like everybody's trying, on the doctor's side, everybody's trying to do that, to accommodate and reach out to patients as best they can. The advantage of telehealth is you don't have to be in the same geography necessarily as the doctor that maybe you're communicating with or connecting with. But if you have specific needs that you need to see the doctor for, that still makes it, that it's still a problem or still a challenge. I think that in my practice, I do let people come in to see me if they really want to.
mhm.
And I also like, for new patients coming in that I've never seen before, I actually encourage them to come in so that we can meet face to face. So I think if you want to meet face to face with patients, I think there's a place for that. Of course, not everybody's comfortable with that. Some people have a lot of risk factors and they don't want to go out in public. And I respect that. If the person doesn't want to come in and they want me to talk with them, while they're at home, I try to accommodate that. If they really want to come in and talk to me, I try to accommodate that. But, there's no, it's not black or white, this
Right.
pandemic and this virus. So it's hard to know what's right.
Right. And maybe the answer is just you have to kind of weigh, your risks with COVID, and maybe it's just not worth it to go in and see this doctor. And so maybe you do need to find someone new just for the time being, or maybe you try to talk to them and, have a kind of heartfelt, like, this is really hard for me to come in, and see what happens. But,
I think the good part about it is if you do talk to them about it at some point, I think the Medicare insurance world is trying to accommodate that right now to allow you to do that so that the doctor still gets paid for their
mhm.
time. So maybe, he or she might be more open to talking by phone or something like that. But
Yeah, no, and I'm trying to remember who it was, but someone made a comment about how, the sort of the silver lining to the pandemic has been, telehealth for a lot of patients, and really the increase in online activities, that are available, and online support groups, and people being more comfortable with
yeah.
doing things online, because we actually, so many people have trouble driving, and just
I think the research and the outcomes on things like psychology-based treatments for telehealth, it looks really good.
mm,
People really do, get a lot out of those sessions. It has good results. So there's a lot of things that we can do. We just didn't really try, because we didn't feel the need to. And now it's definitely a time to grow and branch out.
right. So a few more questions that we have here, and we won't be able to get to everyone's questions tonight, but we'll try to do our best to get to a few more here. So these are a little more specific, but a couple of them I thought were really questions that a lot of people might be interested in the answers to. One was any suggestions you might have for increasing energy when you have chronic pain. I know that we all deal with a lot of fatigue. So I don't know if you have any kind of specific tips for that.
Yeah, so it's a tough one. I think the biggest complaints that I get from patients, besides their pain, is trouble sleeping and low energy.
Hmm.
And I think the two go hand in hand a little bit. Um, you know, Getting a good night's sleep, is gonna. I think research seems to show that we hurt less during the day when we sleep better at night. Yet some of us, we have a hard time sleeping because we're not comfortable when we're trying to sleep at night. So it becomes a wicked thing, and then we feel less energy during the day. Um, I think that there's no magic solution to that, but definitely whatever you can do to improve your sleep hygiene, to get even if it's a half hour, an hour more of sleep a night, it's going to pay off on how you feel during the day. Whether it's things like turning the phone off and setting up a nice place that you can relax in a couple hours before bedtime, to maybe doing some cognitive behavioral therapy with a psychologist for sleep. It's very effective. So there are things that we can do without having to take more medications that can help us sleep better. And then during the day, you have to look at your health as a whole. What health problems do you have? Because they all are playing a role in what you're able to do during the day.
Hmm.
How can you optimize all your medical conditions? If you have diabetes, there's going to be ups and downs with energy with that, and your sugars go up and down. And then any medications you take, a lot of medications that we use to help with our pain can slow us down, both physically and cognitively. And are there, is that playing a role? And are there ways that we can try to cut back on that a little bit? So a lot of things. Anything that you do, you really have to talk to your doctor first. It's not something I want to give like medical advice on. But there are some interesting things out there to look into, like intermittent fasting and other ways of managing your health that might lead to things like better energy or other decrease the impact of other medical problems, and might be worth a look. But don't try anything without talking to your doctor first.
Right. Great advice. And a few people have someone saying that massage helps them with sleep. And I know that for me personally, I wonder if people are the same, but, making sure I'm active enough during the day, even though I have pain, like if I don't do enough during the day, I have a harder time falling asleep at night. So staying mobile, like you mentioned before, is super important. So
Mhm.
maybe just one or two questions, if that's okay with you, Dr. Abachi, and we'll,
Sure,
yeah.
sure.
So let's see here. Someone else was asking about an anti-inflammatory diet. and it seems like a good segue since you just mentioned intermittent fasting. So I was wondering if you had any advice on whether that can be helpful for pain or sort of other nutritional sort of tips for people. Again, I know you can't get too specific,
Yeah.
but maybe you could touch on that.
Yeah, I think it does matter. I think how we feel is at least somewhat impacted by the quality of our nutrition. And, so when I think anti-inflammatory diet, I'm thinking a diet, healthy or high in basically just produce, fruits and vegetables.
Mm.
It doesn't have to be fancy supplements. It doesn't have to be fancy juicing, just basic, fruits and vegetables. If that becomes more of the mainstay of your diet, you're going to cover your bases. And I use the rule of seven that I've talked about before, is to try to have seven different types of fruits and vegetables throughout the day.
Mm-hmm.
Try to hit that number every day. And I think if you do that, you will provide yourself a good basis of healthy anti-inflammatory foods. And I think, it'll help reduce swelling. You won't feel as bloated, when you eat better. Certainly weight loss, is important in some cases to reducing pain symptoms, can have a role. So good nutrition that leads to slow, gradual weight loss can be healthy and effective. So there's a role, there's definitely a place in it, and it has to be something that can be a good long-term strategy.
Great, thank you. And one final question that we have here that's close to my heart and ties to our Pain Awareness Month theme. And I don't know if this is a question that was submitted before the event via email, so I don't know if she's on, but I think it's something that all of us are interested in working on. We all know that multidisciplinary care is the best type of care. We know that, using different modalities across disciplines, usually that combination of things is there's no one thing that can fix our pain. We have to kind of, try all different things out and see what works for us as individuals. The problem is that insurance often isn't on the same page with what we know is best practice from a clinical perspective. So this person had asked, what do you think that we, both as patients and as providers can do to try to move the needle with insurance and encourage them to cover a broader range of therapies, especially when our doctors are recommending them, but maybe we have like a 10 visit annual limit on our PT. So we, can't really, do it for very long. So I didn't know if you might have some thoughts on that.
Well, it's a really good question, and it's a battle that I feel like I'm fighting every day. And I'm pretty passionate about that, and I'm with you. I'm with you guys on that. And it's not right. It's not fair. One positive is over the last year, Medicare has started to cover acupuncture for the first time for low back pain.
Yep.
And so I think if you follow what's going on at some of the places at a regulatory level like the NIH, and they're the leadership there is very wellness focused, health and wellness focused. And I think they see the value in these kind of things. And so I think, speaking to them, people at a government level, regulatory level, maybe at a national level, which I think U.S. Pain Foundation is pretty good about doing, but continuing to have their ear, because I see people there, who are writing articles or writing on Twitter or things like that seem to be in line with that. And so it begs the question of, well, why don't you make it, more accessible for people? But I think that's where there might be some traction, maybe,
Right.
hopefully.
Right. And I'm so glad you brought up the acupuncture example, because that's sort of it seems I would never in my wildest dreams thought that, CMS and Medicare would cover that, but they are. And I think, the difference is patients really speaking up about using acupuncture. So definitely important that we all kind of work together on this issue, and joining us during Pain Awareness Month and helping spread the word about our theme, I think could be one small way to make a difference. So final question, then I'm going to let you go. Someone was asking if you are accepting new patients because they really enjoyed tonight's webinar.
Be careful what you ask for, people. I, I'll put up my, yes, yeah, always, here to help and see folks. I'll put up the contact information. Um, so you can reach out in different ways. You can send me messages on Facebook or Twitter. You can go to my practice website, ipmdoctors.com, for referral information. If you want to get access to any of my materials, like my books, you can get them on Amazon. I write articles for WebMD just about every month. If you go to the news and experts section, and then go to WebMD blogs, there's a pain management section. That's my section with WebMD. And so I'm always putting new things out there. And of course, the Pain Relief Revolution site, we update the content there. And that's not sponsored, and don't get any money for that. So you can get information. I also have some pain management apps with a meditation app called breathe.com. I have like a 10-part series there for people who are interested. You can do some work from home with that without having to see my ugly face in the office if you don't want to. And then of course we'd love to meet you if you're able to come, if you're in the Northern California area and would like an appointment to come in and chat. I would love to do that.
Awesome. Thank you so much. Thank you, Dr. Abaci, for sharing your time with us and your tips with us. We appreciate it so much. And if for any of you who live in California, I'm very jealous that you might be able to see Dr. Abaci. So before we end, I'm just going to tie up some loose ends and talk about some of our two upcoming events that hopefully you might be interested in. But thank you again, Dr. Abaci. We really, really appreciate your time.
Thank you. My pleasure.
Okay. All right. So before everyone jumps off, I know that it's late, so I'll be quick, I promise. So I just wanted to talk about our two upcoming events that I hope you'll join us for. The next one is September 17th at 1 p.m. with Dr. Edgar Ross, and he is the director of the Pain Management Center at Brigham and Women's Hospital in Boston. So he is definitely another excellent expert, and he's going to be talking about how and when to use cold versus heat therapy. If you're like me, you get confused and you use both, but you're not really sure when to use one versus the other. So I'm really excited to attend that one and learn more. We also have an event called My Pain Journey, which is going to be a panel with 4 patient advocates talking about sort of how they arrived at their current treatment plan, and talking about multidisciplinary care and sort of the different options that they combine together. So if you want to register for those, again, just visit the US Pain Awareness Month website, uspainawarenessmonth.com. So thank you guys so much for joining us. We really appreciate it. I'm going to close down on Facebook. So Facebook, thank you also for joining us, but I'm going to stay on and answer some of the questions in the chat that we didn't get to. So thanks again, guys, and we will see you next time.